Good morning, everyone. Today was going to be a little bit of a short session. I want to get through a few kind of specific poses, continuing to work on improving our breathing mechanics, bringing some breath into our upper chest, into our upper back, down into our low back, as well as continuing, working on opening up the hips, getting some hip mobility and thoracic mobility to go with our shoulder mobility. So, anytime we're working in breath, getting into like the deeper layers of our breathing mechanics, I always want to be wary of, triggering any kind of anxiety, fear response. So we're going to be getting into those deeper layers of breath. If anything feels like it's getting triggered, it's okay to back off. Give yourself some space. I don't want you to force through it. I don't want you to push through it. So with all that, let's get started. So we're going to start in our quadruped today. So I want to get nice spread hands, grounded palms, extended elbows. Also want to make sure that the toes are already tucked underneath. I want to have the big toes lightly tucked underneath as if we're going to sink back into them. We'll get into the feet just in a little bit. First thing is I want to work on our breath, bringing in that crocodile breath, breathing into our abdominal section, feeling that breath move into the belly, but I also want to breathe out through the sides and into the low back space. So I want to think of the abdominal wall like a balloon. We're trying to get it to expand in all directions. So we're going to inhale through the nose, filling up that abdominal wall. As you exhale through the mouth, and we're going to draw the navel up and in order to press all that air out of our abdominals. And as soon as you get that last bit of air out, we're drawing that breath right back in, seeing if you can fill up the balloon of the abdominal wall. And as we're going back and forth with inhale to exhale, I want to start to notice that natural shift of the pelvis. As we exhale, drawing that navel in, the pelvis is naturally going to scoop. And we might even get a little bit of mobility in that low back, might get some stretch in that low back. As we inhale, pelvis is going to tilt down towards the floor, belly opens up a little bit more, we get a little bit more sway in our back. So we're going to get into our pelvic tilts. Now, as we get into the pelvic tilts, it's going to be harder to expand that balloon into the low back. We're still breathing in like a crocodile, but we're allowing this movement to take place, which is going to close off some of that low back breath. So nice, fill up that belly on the inhale, let the pelvis tilt to the floor. We're moving into that sway back as much as you can without going into pinch or pain. And then on the exhale, scoop the tailbone. Feel that pelvis scoop. I want that movement to go into the low back. We're not going up into the chest or shoulders just yet. Only want to feel that movement at the pelvis. With each one, see if you can scoop a little bit more to feel that mobility in the low back. On the inhale, see if you can tilt to the floor a little bit more. Can you get a little bit more sway in the low back without pinch or pain? And now I want to start to free up the rest of the spine. So as we exhale, drawing that navel into the spine, we're going to continue to scoop and then press through the hands. Feel that stretch up into the upper back. That movement can go across the head, and at the very top, we're trying to touch our tailbone and our forehead at this imaginary point right in the middle. Then we're inhaling. That's going to draw the pelvis to the floor, and then I want to feel each segment of the spine move to the floor till we get to the chest. Chest drops to the floor, and the head comes up last. Going back and forth. nice and slowly. The slower the better, especially if you're feeling any kind of low back tightness or tension. I do not want to move through that space quickly. My low back is a little tight this morning, so I want to go extra slow, especially if there's a little bit of discomfort. If you're feeling any level of pains as like a 1 or a 2 on that scale of 0 to 10, even if it's not triggering a 3 or above, I want to slow it down even more if you're feeling it at all. On the next inhale, as we exhale, getting into our nice big cow position, I want to stay in cow. I want to stay with this nice arched back. And now we're going to bring our inhale breath up into our upper back. So as we inhale, I want to inhale breathing into that kind of back of, right at the base of the shoulder blades, mid-back, bra line area. Feel that inhale lift that section of your spine to the ceiling. As we exhale, we're going to scoop more into it. So we're staying in this arched position. Inhale, we're trying to feel that lift the spine. Exhale, we're scooping into it a little bit more. See if you can feel a nice stretch associated just with that inhale. And then as you exhale, we're pressing a little bit more through the hands and scooping a little deeper into it. I don't want this to be a massive, massive stretch, but I want to see if we can get just a little bit more mobility from that inhale into the exhale. Then we're going to come back into our inhale, letting the hips drop to the floor, opening up the belly. Exhale, scoop. We'll do 3 to 5 reps of just moving back and forth through that nice wave, inhale to exhale. We're going to then come off the wrist for a little bit just to kind of roll them out, give them a little bit of relief. We're going to come back to our hands. Now we're going to get into our child's pose position. So again, I still want those back toes tucked, but we're bringing our hands as far forward as we can. Keep them spread. I want to try to keep the hips as much over the knees as possible. I want to try to avoid letting the hips rock back behind the knees. If you have shoulder discomfort, shoulder instability, you're probably going to need to sit back a little bit to have some of the weight in your hips as opposed to your legs. So kind of adjust based on what you need in the shoulders. But if the shoulders feel strong enough and are solid enough and not painful, I want the hips directly over knees. Hands are going to be spread wide. Elbows are extended and active, and we are pressing downward into the floor. From here, the first thing is we're coming back to our pelvic tilts with our breath. So inhale, let the pelvis tilt to the floor so you get that same sway in the low back. Exhale, draw the navel in as you scoop. See if you can feel that light stretch in the low back. Inhale and exhale, trying to get as much mobility through the pelvis and the low back as possible. On the next inhale, as you get nice and it opened up through that belly, on the exhale, we're going to reach our sternum to the floor as we're scooping. I want to have that active scoop as I'm dropping the chest. That's going to help keep our rib cage drawing in instead of jutting out. So I want to have that nice scoop so we have a nice flat back, rib cage in. Inhale, we're coming all the way back up. Exhale, we're reaching our sternum down to the floor. Keep those hands actively pressing into the floor. Elbows are active and actively straight. And with each one, see if you can drop your chest a little deeper into those shoulders. How do the shoulders feel on the right side compared to the left side. We're going to do about 10 reps of these, seeing if we can get those shoulders to kind of open up a little bit, feel stable. I want to make sure that they are not painful or overly stressed. On the next one, as we drop down, reaching through the sternum, we're going to stay down. And from here, we're doing our press, pushing forward through our hands. But our hands are stuck to the floor, so it's sliding our hips back so that you feel your shoulder blades move up to the ears, and then we're pulling from the hands, keeping the elbows actively straight. Feel the shoulder blades slide down the upper back. We're inhaling as we push, inhaling as we pull, exhaling as we push. I'm going to come off the shoulders, give them a little bit of a rest. We're going to come back into quadruped one more time just to get a little bit of mobility into the feet. So as we come back to spread hands, grounded palms, I want to tuck the big toes underneath as much as possible. We're going to inhale as we're rocking forward into our wrists. We're exhaling as we're letting the hips sink back towards the heels. And I want to very specifically feel the weight of the heels in the ball of the foot. Can you feel that stretching out the knuckles of the foot? Can you feel it lightly stretching into the arch of the foot? Inhale, we're rocking forward into the wrists. Exhale, we're rocking back into the feet. As we're rocking forward and back, each time we rock back, I want to start to change the position of our heels. So on one, we're going to roll the heels out so that we're getting tucked underneath out to the pinky toe as we sink back hips to heels. Inhale, we're going to bring the heels inward as much as we can so that we're moving into the big toe space as we rock hips to heels. And so each one, we're windshield wiping those heels out and in order to kind of get into different levels of that foot. And as you're going back and forth, notice if what feels different on one foot compared to the other foot. Does one side feel tighter, more restricted? Is it at the big toe side or is it at the pinky toe side? And we can also just kind of take a notice of how the knees feel as well. Does one knee feel a little tighter and stiffer? Is it hard to get back into that foot because the knee feels restricted? Then last, we're going to let the ankles go nice and flat, and we're going to do the exact same thing. Rocking back hips to heels, seeing how deep can we go. Inhale, we're coming all the way back forward. Exhale as we sink. Inhale as we come forward. If this is feeling good, if you've got enough space to be able to sink your hips to the heels, we can start to let our weight move back to our heels. But I want to make sure that this is not painful on the knees. And I want to make sure you are able to get your hips all the way to the heels before you start loading all the way into a deep sit. All right. So we're now going to change, getting into our inverted position. Hands are coming down, grounding at the hips. And we're going to start with elbow spirals. Basically, we're going to get into some cat-cows from this position, but we're starting with spiraling the long arm bone, focusing on the elbow pits. So I want to externally spiral both arms. As we do so, notice how the shoulder blades naturally want to roll down and back. And I want to feel that opening up of the chest as the sternum lightly lifts to the ceiling. This is our inhale phase. And on exhale, we're going to internally spiral the elbows. As they internally spiral, the shoulder blades are going to want to round forward and up towards our ears. So we're going to allow them to happen. I want to get this nice rounded upper back as we roll our elbows in on our exhale. And as we roll the elbows out on our inhale, we're getting nice and tall. I want to feel the shoulder blades reaching down the back towards the floor. I want to feel the sternum in the top of the chest lifting up towards the ceiling. Inhale as we get nice and tall. Exhale as we spiral internal. Let's start to add in the mobility of our pelvis with this. So as we're inhaling, elbows spiral out, shoulders pack, pelvis is moving forward. We're getting tall, getting that sway in the low back. On the exhale, we're scooping the pelvis. As our shoulders roll forward, our pelvis is scooping underneath. So we should be able to feel a nice mobility stretch in that low back all the way across to the upper back. Inhale, we're feeling for that packing of the shoulder, opening up and lifting of the chest. On the next inhale, as you get tall, we're going to stay tall. At this point, if you want to go into a cross-leg sit, that's fine, as long as we're still grounded down through our hands, pressing down, feeling those shoulder blades packed. At this point, we're going to work on bringing a breath into our upper chest specifically. So we're going to maintain this position. I don't want to change the shoulders. Inhale, we're going to breathe in very specifically up into our clavicle region, like this high up into our upper chest, base of the neck space. I want to fill that up, feel it lift up on our inhale. On our exhale, we're going to stay tall, and we're going to add a little bit more external spiral to the elbows. So we're not going back into our internal rounded shoulders. We're staying tall. Inhale, I want to see if we can feel a stretch related to bringing breath in and feeling the balloon of the chest expanding out. And then on our exhale, we're going to spiral out and away to try to stretch a little bit into that space. We're going to kind of like, can we get the balloon to expand? And then can we cinch that balloon down by spiraling into it a little bit more? Can we get a little taller with each inhale and each exhale? So inhale, breathing into that upper space. Exhale, reach into that upper space by spiraling and lifting through the sternum a little bit more. We'll just do 3 to 5 breaths on this one. On the next inhale, as you exhale, we're going to let the arms spiral in, going into our rounded upper back. We'll go back and forth 3 times, inhale to exhale, spiraling in, spiraling out again. So inhale gets us nice and tall. Exhale spirals us nice and small. Rounded back, rounded shoulders. Inhale, nice and tall, open chest. On the next inhale, as you exhale, we're going to stay rounded. I'm internally spiraled. I want to be very active in that spiral. I want to feel tension through the hands, turning the elbow pits in. In this now, we're going to work on breathing specifically into our upper back space, kind of aiming for around the shoulders, between the shoulders area. On our inhale, again, I want to feel the lift of our breath moving into that upper back. On the exhale, we're going to cinch internally a little bit more, trying to get a little more rounded in the shoulders. Can we get the shoulders to move even more forward towards our ears? Can we feel move into that upper back space that we're breathing into? So again, inhale, fill up that upper back. Exhale, see if you can cinch that space back up. Notice if you can find that stretch associated with the expansion of the balloon. And then can you feel a stretch associated with spiraling of the elbows internal? And it's not a massive stretch. We're kind of just moving. We're just kind of getting that stretch focused in that upper back space. After 3 to 5 breaths, we're going to come back, going through the full range. Inhale, getting nice and tall, lifting up through the front of the chest. Exhale, nice and rounded, feeling that scoop of the pelvis. And notice, do you feel like you got a little bit more range of motion of this going from cat to cow? Do you have a little bit more expansion of your breath in both directions? Now on the next inhale, we're going to get nice and tall, packed shoulders, and I want to stay here. Now we're going to work a little bit on our neck mobility, and we'll bring some breath into the neck region as well. So we're going to just kind of get into our light tilts and lift. So we very lightly want to let my ear drop towards my shoulder. I don't want to reach to the shoulder. It's not a big drop. I'm just barely moving it down a little bit. Then the opposite ear, I'm imagining that I'm trying to lift that ear to touch the ceiling. And we're going to go side to side on this. So I want to exhale as we lift. Inhale as we come back to center. Exhale as we lift to the other side. As you're lifting the ear, you can also actively press down through that same side palm. Feel that shoulder slide down the ribs, down the back. I want to make sure that we're also lifting up through the front of the chest. I want to feel the chest expand open, shoulders packing down as we're lifting that ear so that we get a nice traction stretch kind of in this side of the neck. As you're going side to side, notice, is this more difficult to do on the left side compared to the right side? Is one side tighter, more restricted, or is it just hard to kind of figure out the movement? Does it feel like you just don't have a lot of neurological connection to one side compared to the other side? Good. Next, we're going to do just a little bit of light checking our blind spot. So looking over the left shoulder as we exhale, inhale back to center, exhale as we look over the right shoulder. And with each one, I want to slowly squeeze, and I'm really kind of reaching my chin as far over the edge of the shoulder as I can. And notice how far are you able to go on the right compared to the left. And does one side feel tighter and more restricted than the other? Good. All right. We're going to get into a nice wide V-sit next. Getting as wide as you can comfortably with the legs. Knees are actively reaching down into the floor. Top of the feet are actively pulling back like you're trying to fold your foot back to touch the shin. I want to be very active with this. Actively reaching down, actively pulling back. The more active you are, you should feel those quads kind of naturally tighten up. Hands are coming to the hips, grounded to the floor. and we're going to spiral those elbows out in a way to feel as much open and lift through the chest. We're going to focus on the kneecaps, doing spirals through the leg. We're rotating the knees as far out and away as we can, seeing if we can, like we're trying to touch the floor with our kneecaps. And then we're spiraling the knees as far inward as we can. Again, as if we're trying to touch our kneecaps to the floor. I want to exhale in both directions. So as you externally spiral, we are exhaling. Inhale as we come to the middle, and then exhale as you internally spiral. How does this feel deep in the hip socket on the right side compared to the left side? Does one side feel a little tighter and a little more clunky? Are you able to go as far, especially with internal rotation? Is it different on the right side compared to the left? What about external rotation? Does it feel tighter or more restricted on the right or the left? This one's a super useful and important assessment, especially when we're getting into gait mechanics. I have a little bit of pinchiness on my internal rotation in my left hip, so I'm going to see if we can get that to soften up and give me a little bit more mobility. So far, it's pretty tight. So what we're going to do next is we're going to add in some ankle circles. We're going to do the exact same movement through the knee. We're going to externally spiral, but as we spiral out, we're then going to point the toes, and then we're going to spiral all the way in, and we're going to pull the toes back towards the shin actively as we spiral out. With each one, I want to see how big can I make the circle at my ankle while still maintaining the spiral through my leg. How far internal can I bring my knees? How far external can I rotate my knees? We'll do 5 up to 10 circles in one direction. We can start to work on point and even slightly flex the toes as you reach away. Can you open and spread the toes as you pull them back? And then we're going to reverse direction of our circle. So then going the opposite way, reaching away, spiraling out, pulling back. Again, if you can get a little wider with your hips, you can bring in a little bit more space. Again, I want to notice, do the hips feel like you're starting to get a little bit more range, opening to them? Are they opening up? Are you able to spiral a little bit more in each direction? I'm feeling my left hip opening up just a little bit. Good. So we're going to keep our legs active. I'm bringing my hands up forward. We're going to get into our forward folds. I want to be a little soft in the knee, but I want to continue to pull the feet back towards the shin somewhat actively. We're going to get into a nice inhale as we get tall. Our exhale, we're folding and reaching both hands evenly. Inhale brings us all the way back. This is where I like to imagine my hands are like the wave moving up a beach. Nice exhale as we crest. Inhale as we recede back. As we're doing this, notice the back line of the legs, hamstrings, back of the knees, down into the calves. Also notice low back. Are you feeling tightness in the low back, or are you feeling tightness in the back of the legs, or are you feeling it in both? I want to be soft with it. I don't want to force it. Again, I'm feeling some tightness in that low back space. We're going to see if we can get a little bit of breath into that area of the low back. So on the next exhale, as you reach, I want to reach softly. I don't want to go to a maximum range. And from that reach, we're going to see if we can breathe into our low back space. So this is just like we were doing in the upper back. I got a nice fold, my hands are forward, and I want to remain actively reaching forward. but I'm going to breathe. That breath is moving into the low back space. So as it fills that space up, it's going to pull my hands back lightly. On the exhale, I'm reaching a little bit more forward. Inhale, filling into that low back space, very intentionally breathing into this space. Can you feel a stretch associated with the inhale phase of your breath into that low back? And then on the exhale, can you reach a little bit further? And we'll get a good 3 to 5 full breaths. Then we're going to let that inhale bring us all the way back up. Exhale lets us fold. Inhale brings us up. And now I want to bring our reach. We're going to start reaching a little bit side to side, moving off center. Nice exhale. Inhale as we get tall. And then exhale, reaching to the other side. Again, I want to pay attention to how this feels in that low back space, but also the back of the legs. Does it feel a little tighter and more restricted when you reach towards the right compared to when you reach towards the left? Are you able to reach farther in one direction compared to the other? As we're going side to side, we can continue to start to open up how far we're reaching. Going all the way out to the heels. We can even start to reach a little bit beyond the heels. Good. All right, so now we're going to get into our shin box position. I'm in my left side shin box. My left hand is coming down, grounding to the floor. And we're going to focus on that back hip. Want to inhale, allowing that hip to drop down to the floor. Exhale, we're lifting and scooping that hip up and forward, feeling for a light stretch through the front of the hip. Inhale, letting it drop. I want to feel how far, range of motion wise, can I go from floor, hip reaching backwards to the floor, and then the hip lifting off the floor and reaching forward, scooping into it. I want to see how much extension can we get in the front of the hip at the top, lift it off the floor, and how far forward. And inhale, how far back and dropping it to the floor can we get. Notice where the tightness is. Notice where is the restriction in the range of motion? How much range of motion do you have? This is something we're going to compare to the other side. Once we've done 5 breaths, we're going to slowly transition to the other side. Again, inhale into that back hip. Feel that hip drop to the floor. Is it able to get as low as the other hip? Exhale, we're lifting that hip up off the floor, reaching it forward and scooping it into it as we go. See if we feel that light stretch in the front of the hip. Inhale, how much can you reach into the floor? Exhale, how much can you lift and reach forward? How far does that hip travel on this side? Is it different than it was on the other side? Are you able to go farther or are you able to go less? Does it feel more mobile? Does it feel looser and easier? Or does it feel more tight and restricted? The differences between one side and the other are really, really important to pay attention to. And if you have significant imbalances in that mobility in the hips, then these are movements that would encourage you to do more every day, like 2-3 times a day, until you can get these to balance out a little bit more. As long as it is not painful, I want to do it with as much frequency, 3 to 5 reps, multiple times a day. We're going to switch back to the other side. Again, grounded palm. We're going to, got the same movement of the hip. Inhale as it drops back. Exhale as it scoops. But now we're adding in our reach with rotation. Like we got a piece of bread, and I want to reach straight through the arrow of the knee. So as my back hip comes forward, getting into that loaded stretch on that hip, I'm then exhaling and reaching with my fingers through the knee. Inhale, bringing it all the way back, hip to the floor. Exhale, scoop, hip goes up and forward, reach through that knee. See how far can you get those fingertips to go from that back knee. We can almost like we're pushing through the floor in that knee in order to get that hip to extend, and then we're pushing into the fingertips. How far can we get those fingertips to extend? Then switching to the other side, doing the exact same thing. Nice grounded palm. Inhale, bringing that hip back. Exhale, lift, scoop, load that hip, and then reaching through the arrow of the knee. How does it feel on this side compared to the other side? Does it feel more mobile, or does it feel tighter and more restricted? Is the tightness and restriction in the hip when you extend that hip forward, or is it on the rotation as you reach? I'm feeling it on this reach. My hip is tight, but man, even tighter as I add in that rotation. Good. Once we've done 3 to 5 on both sides, we're going to come back across to the other side. At this point, I want to let both hands come down and ground. I'm kind of leaning a little bit back into our hands. Spiral both elbows out so that we got that nice open lifted chest. And we're going to do our hip mobility focusing on this back leg. Keeping the foot in contact with the floor. We're seeing if we can lift that knee up towards the ceiling, and just how high can we lift on the exhale. Inhale, we're letting it come back down. I want to go slow and squeeze into it softly to make sure this is not painful. Exhale as we lift. Inhale as we set it back down. We're doing 5 slow reps, synced with our breath on this. On the 5th one, we're going to very slowly let both knees windshield wiper all the way across to the other side. Hands should be able to largely stay in the same position. And we're going to focus on the opposite side. Inhale, exhale, light lift. Inhale, let the knee back down. Exhale, squeezing into it a little bit more. How does this hip feel compared to the other hip? Is it tighter, more restricted, less mobile? My left hip is always a little tighter in this movement. After 5, we're going to come back, and I want to do that one a second time on both sides. So again, nice inhale, exhale, lift. My right hip, I got a good amount more range of motion, a good amount more mobility. So again, in the movements that you find an imbalance on, where it feels really difficult on one side, those are movements that we want to do more frequently throughout the day. Once you've done 5, we're transitioning back to the other side and doing another 5. And hopefully you're finding that the second time around, both sides feel a little bit more mobile. My left hip, still tighter than the right, but a big difference. It actually almost feels like I'm getting a lot closer to similar range of motion the second time through. After 5, we'll come all the way back across, and now we're going to get into our folds. In folds, I want to work back and forth. We're going to be moving through the shin, so I want to reach both hands evenly through the shin. I don't want one hand going further than the other, and we're going to transition across on each one. So it's a nice exhale as we fold. Inhale as we come all the way back up. Then transition, we'll take a breath cycle as we transition so that we're ready for a nice exhale as we fold. Inhale as we come back up. Exhale as we transition across. Inhale into an exhale of our next fold. I want to go slow. This is 2 breaths per side with one breath as our transition. A full breath as we fold and come back up, and then a full inhale, exhale as we transition, a full exhale, inhale as we fold. Notice, how does this feel on the right side compared to the left side? Does one side feel different? And if it does, how does it feel different? Where does it feel different? Is it tighter? Is it more restricted? Is it clunky? Is it painful? If it's painful, then I want to back off. I want to make sure that you're going soft and slow and smooth and non-forcefully, non-painfully. As we're going back and forth, now I want to start to open up the back leg, opening up our shin box, making the thighs a little farther apart. We can now start to deviate from our shin with our reach. We can kind of reach in whatever direction feels juicy, feels good, feels like it gives us good access to more mobility. And then the same thing to the other side. Opening up that back hip as we get a nice reach. Inhale as we come back, cross to the other side. And we're going to slowly continue to open up that back leg more and more on each one so that we're slowly working towards kind of that classic yoga pigeon pose. Although I'm not overly concerned about that end range pose. So if you feel stiffness, tightness, restriction, pain in that hip as you're opening, if this is as far as you feel comfortable opening up that hip, then this is as far as I want you to go. I do not want you to force into deeper ranges if you're feeling tightness and restriction. Allow your body to open up those spaces on their own. We'll get 2 more breaths on each side. This one really seeing like just how far can you reach the back foot back, how far can you extend through those fingers without forcing it. Nice slow breath as you go side to side. Get one more cycle through. We will finish up by getting on our back. Feet are nice and flat to the floor. Arms are resting at your side, palms up. Allow your shoulders to relax down to the floor. And I want to get some nice full breaths. filling up into the belly, that nice crocodile breath. Feel it expand in all directions on the inhale. Exhale, feel that navel draw into the spine. We'll get 5, 6 nice cleansing breaths and kind of just checking in and noticing if there's any other areas in the chest, the ribs, low back, upper back that feel tight and restricted. And if you feel that, then we can bring that breath into that space, filling it up on the inhale, breathing into the tension, and then on the exhale, allowing that tension to just rinse off onto the floor. Each breath, see if you can fill up the abdominal wall a little bit more. See if you can fill up the chest and the ribs a little bit more. See if you can breathe in and fill up the upper chest into the neck. And then can you breathe down into your pelvic bowl? And when you're ready, go ahead and open your eyes and take your time sitting up and coming to a sit or a stand. You want to make sure that you're not feeling dizzy or lightheaded before you stand all the way up.